Welcome, everyone. Thank you for joining us today for the roundtable COVID-19 and the Classroom, as presented by TV Asia and the American University of Antigua. This series of roundtables features our very own professionals practicing both in India and in the US. This gives the audience a chance to listen, to learn, and gather more information. My name is Par Prem Kumar, and I'm advisor to the President for Special Projects. Today's discussion provides us with a unique opportunity. Please do send in your questions at the end of the program. AUA alumni are here, along with professionals, to speak about the COVID-19 and the classroom as in-person learning starts for schools and universities. So let's meet our panelists. I request them to introduce themselves briefly. Let's start with Dr. Harsh Sehgal.
This is Harsh Sehgal from sunny California. I've been here in Fresno since 1978 in solo practice. I spent most of my time in my office practice and about 10% in the hospital-based practice. I've been chief of medical staff at Children's Hospital, St. Agnes Hospital, and Clovis Community Hospital.
Dr. Dhanya Dharmapalan joins us from India.
Hi, I'm Dr. Dhanya Dharmapalan. I'm a consultant in pediatric infectious diseases at Apollo Hospitals, Navi Mumbai in India.
Thank you, Dr. Dharmapalan, for joining us this late in the night. Dr. Anil George, you're next.
Hello, everyone. My name is Anil George. I graduated from American University of Antigua in 2013, and I'm currently working in the oncology division at Texas Children's Hospital here in Houston. Thank you for having me on today.
And then we have Dr. Jessica Soni.
Hi, my name is Dr. Jessica Soni. I graduated from American University of Antigua in 2013, and I currently am an attending physician with Caremount Medical Group in upstate New York.
Dr. Chaco, let's hear from you.
Hi, my name is Dr. Kevin Chaco. I graduated from AUA in 2018, and I completed my pediatric residency at UTMB in Texas. Currently, I'm a general pediatrician in the Dallas area.
From starting medical school to where they are now, the medical school grooms you to be more than a medical doctor. However, this pandemic has put a different twist on medicine, and I think what you face in your day-to-day practice. As Dr. Stephen Covey rightly said, start with the end in mind, but this is not always the case, as COVID has taught us. Let's start at the beginning with our panel of alumni. Offshore and international medical graduates are in every field of medicine and in some very difficult to achieve roles. Did you feel that you were well prepared for residency and beyond from the rotations and the academics you went through as alumni of the American University of Antigua? Let's start with Dr. Soni.
I do believe that is true. When I was looking into medical schools and during applications once I graduated from college, I wanted a medical school that was quite similar to the experience I would have in the United States when it came to the semester layout, when it came to the basic sciences, curriculum, and also when I came back into the States when I was doing my clinical rotations, the location for it to be kind of close to home and the options that I had. So when I was looking into medical schools, AUA fit the bill for exactly what I was looking for.
We're really glad that we did what you wanted us to do. Dr. George, let me ask you, I know you've gone into a very difficult field to specialize in. Do you think that you were well prepared?
My experiences at AUA taught me two things. The first was the importance of having a consistent work ethic. And the second thing was being able to adapt to the situations and circumstances around me. Medical education and my rotation experiences and having the opportunity to work with different teams of doctors and nursing staff, you learn the importance of being able to provide care for your patients. And what makes our position very unique is that this is not an 8 to 5 job as some other professionals may have. that you're always working with and thinking about and caring for your patients and being able to adapt to different situations. When I look back, I spent 16 months in Antigua, and from there I went and rotated, all throughout the East Coast and Midwest, and did my residency in Kentucky, fellowship in Chicago, and now I'm currently here in Houston. So when I look back on my time, I can't even believe that I've been in all these places. But my experiences at AUA have taught me and given me all the tools that I need to be able to succeed and adapt to these situations.
That's wonderful. That's definitely kudos. Thank you, Dr. George. Now, Dr. Chaco, you're the youngest of the troop. Tell us what you think in the midst of this pandemic. I know you're finishing your residency, you're going on. Do you think that you were prepared?
Yes, definitely. I had a unique experience with AUA, being that after high school, I went to the direct medical route. So I did my pre-med in Antigua, and I also did my medical school in Antigua. I think what helped me the most were the rotations that I did in the United States. I spent most of my time in Atlanta and New York, and those rotations were very valuable in preparing me for residency in Texas.
So, given the present scenario of the vaccinated versus the unvaccinated, what would be the first advice you would like to impart to parents of the children going back in person to learning in the fall? Dr. Saigal, I know you have a very robust practice. Can we hear from you?
So thanks for the question. My advice would be, before we send the kids to school, I would recommend the parents get vaccinated. It's sad to see when they bring the child to see if the kids got COVID, but the parents are sick and they have not been vaccinated. So that's easily doable stuff that before we get the kids in the school, if we get the parents vaccinated, that decreases the chance of home infection. And then dealing with the infection in the school gets a little bit easier. The challenge that I am facing is everybody who's got a cough or a cold is a potential COVID patient. So who to test, how much to test. Everybody who gets sneezed at the school gets sent to the doctor's office to get tested. So it's a big challenge in my office.
Okay. Dr. Dharmapalan, give us your perspective from the other side of the world. I know situation is just as bad, if not worse, in India. And what are you seeing, and what are the limitations you feel?
So we haven't started vaccination in school children yet. Very recently, Zydus Cadila vaccine was given emergency authorization, and we're looking for age above 12 years. We're looking forward for the vaccination to start above age 12 years. And there are ongoing trials for children about 2 years by Bharat Biotech Company, and we're looking forward for the results. So soon we shall be starting vaccination. Now, the issue is I want to convey that though COVID continues to be largely a mild illness in children, uh, children who have comorbidities such as heart problem, liver problem, they can have a severe course of illness. Also, very rarely, some healthy children post COVID can have a complication which is called as MIC, occurring maybe about 4 weeks after COVID, which requires hospitalization and could be life threatening too. Now, when vaccinated with any available, currently available vaccines, all vaccines prevent serious course of illness or hospitalization. So, parents must remember that though COVID continues to be mild infection in children, it can have a serious course of illness in those who have comorbid conditions like heart problem, liver problem, and there is a possibility of a rare complication called as MIC post-COVID about 3 to 4 weeks after in healthy children. So we need to definitely prevent COVID in children. At the same time, we must remember vaccines do not 100% protect against getting infection, though all available vaccines protect against severe complications or need for hospitalization. So, therefore, it is still crucial to wear masks to prevent, even if the child has received vaccination. And the other COVID appropriate behaviors also, like social distancing, avoiding overcrowding, and this the parents should talk in a positive language, in an age appropriate language, and make children understand why they need to wear masks, and that would make children more feel more responsible.
And I know with the absence of vaccines for the under 12 here back in the United States as well, it is worrying. It is worrying for the parents and the grandparents and the extended family when the children start going back in. What do you think we need to do? What do you think is the best thing for us to do? Dr. Soni, I'm sure you're seeing a lot of patients now, with the same question. What would your answer be to them?
On a daily basis in my practice, at least one or two families are asking me, Dr. Soni, what can we do? The FDA has yet to approve the COVID vaccine in our children less than the age of 12. They're starting school back up in just a week after Labor Day here in the States, and how do we protect those? So the answer that I give them is we have to help educate and help to mitigate these factors. So yes, under the age of 12, we are not able to vaccinate them currently, but the loved ones who are in the immediate contact with these individuals, the parents, the grandparents, the primary care providers, the caretakers, the teachers, to educate for everyone who doesn't have a medical exemption where they cannot get vaccinated to get the vaccine. There's a lot of information out there, whether it's in the news and social media. Some parents, there is some parental hesitancy, but I do notice that once you ask the parent to, what are your thoughts? What are your hesitations? Talk to me about the concerns you have. And when you educate them and you explain to them that this vaccine is there to prevent serious illness, like Dr. Dharmapalan had mentioned, currently in the United States, from all the children that have been tested, about 4.8, close to 5 million cases are with COVID positive patients in the pediatric population. But currently, this COVID virus has been now an epidemic in those that are unvaccinated. The FDA is working with approval for younger kids, but when kids are going into extracurricular activities, such as fall sports have started, I advise my parents that if the children are able to mask when they're partaking in sports as an extra layer of protection, have them wear a mask, because these children will have elderly loved ones. They will have cancer patients. They will have loved ones that are, babies and newborns who we cannot yet protect. Children under the age of 2 years old, a mask has not been approved by the American Academy of Pediatrics. So we have to really educate. And once you have an open conversation, a lot of times these parents are able to understand the primary care providers or the physician's perspective, and they're more willing to vaccinate.
You're watching a roundtable COVID-19 and the classroom. We will return after a short break. Welcome back. We're continuing our conversation, COVID and the classroom, with our alumni and the professionals, TV Asia, American University of Antigua. Dr. George, what are you seeing in Texas?
One of the things that we're seeing here in Texas is that this issue of vaccination has become very politicized. And my counterparts and colleagues can speak more to what they're seeing locally. But one of the issues that we've run into is that in terms of getting guidance as far as what to do and what to recommend to our patients and their families is really left to the local governments to help decide to make those recommendations. And when you have that situation, you don't have any national or overarching guidance, there's a lot of confusion. For example, you'll have one school board in one particular county mandate that children wear masks in the classroom, but you can have a neighboring or nearby county or school board that recommends that masks not be mandated in the classroom. So there's a lot of confusion as far as what the parents and the families are seeing as far as what they should do for their children. For us, locally, what we're recommending for our children is that, they wear masks when they're able to, and especially for the patients that I follow and I see, those patients are immunocompromised. They have changes in their immune system, either as a result of this or a treatment for their disease that is affecting their immune system, so it doesn't function as someone with a normal immune system. And so for those patients, we're recommending that they wear masks. The other issue that needs to be balanced with this discussion regarding mask mandates is the potential benefit of socialization. For the past year in the States, a lot of children were attending school virtually. And that was as a byproduct of the pandemic and learning about the effects that COVID could have, not only in adults but in children as well. But now, with persons above the age of 12 being able to receive the vaccine and those under that age participating in clinical trials, we're learning more and more about the vaccine, and so our recommendations are being adjusted or being fitted to be able to match what's being recommended. And I'm curious what my other colleagues think about what they're seeing from their patients and their families in the absence of immunizations for those under the age of 12, what they're recommending for their patients and their families as far as attending live classroom instruction versus virtual instruction.
Dr. Sehgal.
Yes, I see two opposing challenges here. One challenge I see, the kids are having depression issues sitting at home. They're having obesity issues and not getting the exercise they so dearly need. Sitting and watching TV all the time and getting hooked to those video games, antisocial activities. So these are one challenge. Other challenge is to send these kids to school. In Fresno, the schools are already open. They've been open for several weeks now. And everybody in school is on pins and needles as to who's got COVID, who's going to spread the COVID to others. So you got a kid who coughs or sneezes or got little vomiting or diarrhea, gets sent to the doctor's office. And so we are checking everybody for COVID left and right. The hospitals are, especially Children's Hospital, the waiting time is about 6 to 8 hours minimum to check these kids who are sick or the kids who are needing some testing. So these are big challenges, and you can't really say, okay, don't send them to school, because ultimately we have to address these issues. The way I see is, at least the thing that we can do, immunize the parents, immunize the teachers. And there's so many anti-vaccinators here in Fresno areas. We need to kind of somehow deal with these people and get some sense into their head that you're really causing a big problem, that the kids are missing out on their social interaction, the physical activity, learning experience. So those are multiple challenges, but we change and we address them as we go along. So that's where I see the challenges that we need to address.
I agree. I mean, anti-vaxxers actually worry me because, I don't know if they know what they're doing. But having said that, having learned so much about COVID-19 in the past 18 months and the variants in positively the past 4 to 5 months, what do you wish we had done differently, not just for the younger children, but even for the adults? Dr. George?
I think that's a very interesting question, and I think it's a very layered question. There's no simple answer. What I personally wish is that we would follow the recommendations from evidence-based sources. I think this is where you get into the issue of bringing in, what people are reading on the internet and what they may hear or read or see from uninformed sources or sources that aren't based on any evidence. And it's very interesting that for other immunizations, such as the influenza or flu vaccine, or for other recommended scheduled childhood vaccines, I personally haven't encountered much hesitancy regarding that. But for whatever reason, this particular this question about receiving the COVID vaccine and the precautions for managing COVID, both locally in the workplace, in the classroom, and in the community, has become such a hot button issue that depending on the state where you reside in and the city where you reside in, may have different rules. And I'm curious to see what my other colleagues think regarding the question of the COVID vaccine and whether the parents should get it, and for those children who are eligible, if they should get it, if they're experiencing any hesitancy with the other recommended childhood vaccines.
There is vaccine hesitancy here also. And for the other routine vaccination, what has happened is, in general, parents have become fearful of visiting a healthcare setting because of this pandemic. And therefore, the routine vaccinations for other illnesses such as flu or pneumococcal, diphtheria, etc., the vaccination rates have dropped. And that is why we are concerned whether we'll see outbreak of these illnesses soon as the immunized population goes down. But gradually, because of the fall in the COVID cases, we have started visiting the healthcare settings. Parents are more resorting to telemedicine in this pandemic to consult. But of course, vaccination is something that for which they will have to physically come to the clinic.
So, Dr. Soni, what are you seeing at this stage?
Like my colleagues mentioned, I'm seeing very similar findings. So vaccine hesitancy has always been around. That's not anything new, especially after the MMR vaccine and the misconception of that it causes autism. That's kind of a cloud that always hangs above a pediatrician's head whenever we're having a discussion of children and their vaccine schedules. Like Dr. George had mentioned, in the States, everything is done differently since nothing is concrete on a federal level. We follow state guidelines, and even within state guidelines, different districts follow their own Department of Health guidelines. So in the state of New York, and I'm in upstate Dutchess County, our guidelines from the state of New York is actually one of the strictest guidelines we have. I'm sure, everyone would agree, in the entire country. So even if CDC has guidelines, for example, of quarantining for 10 days and Department of Health has quarantining for 14 days, we follow our Department of Health guidelines. Here in the state of New York, and this is different for other states as well, we have certain mandatory vaccines. So certain vaccines such as DTaP and polio, MMR, varicella, tetanus, meningococcal, those are mandatory in the state of New York if anyone wants to go through public education, whether they are doing remote learning, whether they're in childcare, daycares, going off to college. So for these vaccines, whether there is hesitancy or not, if you want to get an education in the state, you must be fully vaccinated.
So, Dr. Chaco, I know you've been, feet on the ground in a hospital. You still are. What is there anything different that you're seeing from what the other doctors have been saying?
It's the similar story. So in residency, we had a lot of parents who were fearful about getting the vaccine. Our recommendation was the parents get the vaccine to protect the child, and we were giving all our kiddos the vaccine above the age of 12. We were seeing some of those scary illnesses like MIS-C in the hospital, and those kids became very sick and needed a lot of respiratory and cardiac support. So although kids in general have mild issues, they can have severe and life-threatening conditions with COVID.
You're watching a roundtable, COVID-19 and the classroom. We will return after a short break. Welcome back. We're continuing our conversation, COVID and the classroom, with our alumni and the professionals, TV Asia, American University of Antigua. given all what we have learned or tried to learn in this time, not putting any of you on a spot, but this is open to the forum. Where do you think we are headed from here?
There is no answer. There's no single solution that's going to fix the problem. But I think everybody has mentioned here, parent education is very important. And that's what the pediatricians do. We talk to the parents all the time, educating them all the time, telling the importance of vaccination, telling them the importance of masking, and taking all the other precautions that they go along with that. I'm hoping before the end of the year we'll have a COVID vaccine available to younger kids. And the studies are ongoing, and I am putting my hope, and actually I'm telling all my parents that stay tuned. As soon as the vaccine is available, we'll be administering them in the office. I have been doing it for every 12 year and above, and we're ready to go as soon as we get a signal from CDC that you can start vaccinating these kids. So we're ready to vaccinate 2 years and above, or whatever the recommendations would be. I think education is very important. I think vaccination is very important, and they have to go hand in hand.
Anticipatory guidance, preventative medicine, and a general pediatrician is someone that parents really entrust in. They respect, they ask you about your professional opinion of what's best for their child. So I think that's really important to have an open-ended conversation with the parents and each parent whose child is eligible for the vaccine. If they are hesitant, to really educate them, to have a discussion with them to understand where their hesitancy is coming from, and to, be a partner and tell them that you are doing this for the benefit of their child. And we all want everyone's safety, right? We want our children to be safe. Those that are unvaccinated under the age of 12, to make sure everyone that surrounds them is fully vaccinated if they're able to. So just like Dr. Sehgal had mentioned, that's very, very important. We don't know what the future entails. This is a novel virus. We've only been in the thick of this for over a year, less than 2 years. There's a lot that is unknown, but from the short-term data that we have, the recommendations are across the board. This vaccine, it prevents death. This vaccine prevents serious illness. And even in healthy individuals, and Dr. George would probably, agree, you don't have to be an oncologist. We're seeing a lot of healthy, fully vaccinated children get sick. And that's where a general pediatrician comes in when we discuss our preventative medicine.
I always say that, we expect the doctors to be empathetic, soft, kindly, understanding our point of view, and also giving us the right medical advice, even if it's fearful. So as senior doctors in the field for a long time, and now mentoring probably the juniors coming in or the residents who are rotating under you, do you see a change in the mindset because of the pandemic? And do you think people are now thinking twice about going into certain specialities? Dr. George, I think you're also in academics. What are you seeing?
Well, that's a good question, because at the outset of the pandemic, there were a lot of restrictions on being able to work with trainees and mentees, just with the social distancing parameters that were in place. But as things started to open up, especially towards the beginning of this year, I saw a lot of enthusiasm. A lot of the trainees that I had the opportunity to work with are just very eager to be involved in the fields. We're all inspired by the images and videos that we're seeing, especially out of New York, where a lot of my colleagues and healthcare members on the front lines were putting themselves at risk to help other people. And I feel that as pediatricians, we're in a very unique position. We're in a position where we're able to follow a child, from the time they're born through the age of 18, and in some circumstances even past that. And we're able to see someone through all the stages of their development. And with the course of that, relationship, we're able to build trust with the patients and their families. And my colleagues can speak to this. I can't tell you how many times we've been invited to certain family events and been updated about certain things happening with our patients. And so the trainees that I work with see that, and that's very inspiring to them. So they're inspired by being in a very unique and novel situation with the COVID-19 pandemic, but at the base and at the foundation of this is still being able to help someone and build that trusting relationship with someone, not just acutely in the course of one day, but over the span of many years. And so that inspires the trainees that I work with to be involved and take a very active and hands-on approach to being in the field, not just for the short term, but also for the long term as well. For my colleagues on this panel, I'm curious if you all have noticed any change in the relationships that you have with your patients and family, just in light of everything happening with the pandemic and with this discussion about mask mandates and immunizations.
Younger people are more driven towards financial goals and going to the GI. Everybody wants to be intensive cardiologist. But the pediatricians are a different breed. We are different people. We love our families. We are part of the families. I have second generation. I have third generation starting to come. They trust me, and they trust me more than they trust their cardiologist or their internist. And if I say something, it means a lot to them. So we should take our role and help the families make the decision, hold their hand, and kind of say, okay, this is what I trust in. This is what I would do for my kid. This is what I would do for my grandkid. And so I think we have a special role to play. I love my field. I'm very happy to be a pediatrician. I would recommend anybody to become a pediatrician. I think it's a very fulfilling field, and I'm proud to be a pediatrician.
I'm sure you're an awesome mentor as well, Dr. Saigal. I'm sure of that. Kevin, tell me, are you seeing any, what I call the chatter on the wire of your colleagues who are worried about what the field they've chosen and what they're doing?
I know with some specialties, COVID did affect it in a detrimental way. For me, it was actually very difficult to get my first job. And so it was the outpatient pediatrician position was pretty difficult to get, but thankfully I'll be working in October. But doing the whole interview process, a lot of clinics had to shut down or lay off some people just because of the flow of patients weren't as much. At the beginning of COVID, a lot of parents were staying home and their kids are staying home. And so that affected a lot of the outpatient jobs. But now I think slowly things are going back to normalcy. And in fact, my job wanted me to start a little earlier in the urgent care because a lot of kids are now being affected with COVID, being that they're back in school. So it's interesting how it kind of changed, but it definitely did affect coming out of residency and getting a position. So it was difficult, but now we're kind of seeing the opposite, where a lot of kids are being affected. So now the pediatrician is in more of a need.
So, Dr. George, can I ask you why you chose pediatrics?
I chose pediatrics because I just love working with kids. What drew me to the field was being able to be in the position to follow a child through the course of their development. When someone comes to the hospital or comes to the clinic, they're not coming because everything is going well. There's usually an issue that you have to work through. And the challenge of being able to work in collaboration with the patient or their family and being able to solve this issue is just very inspiring and very exciting for me. And that's guided my career path into choosing the field that I chose. Unfortunately, there are children who are diagnosed with cancer, and many children are diagnosed with cancer each year. And while a lot of the treatments and therapies that we've learned and have developed over the years have been successful in treating a lot of these children, there are some children, unfortunately, who don't survive or suffer complications related to their treatment. And so for me, it's that ongoing challenge of being able to work with someone, especially when they're at a time of need, and being able to, have that humility and have that understanding and empathy to work with the patient and their family to solve the issue as best as you can and to provide them hope for a cure of their disease.
Dr. Sehgal, I'm curious because all those years back, what made you choose pediatrics?
Well, I actually started from BHU, then I was in Delhi, and I was just sitting and trying to make a decision as to which field to go. And I went to the library, looked around, and they said pediatrics was the field to be, and that was the most sought after field in New Delhi when I was there. And I'm talking about in early 70s. And I did my DCH from Maulana Azad, Delhi University, and I've been in pediatrics ever since. So I never regretted it.
You're watching a roundtable COVID-19 and the classroom. We will return after a short break. Welcome back. We're continuing our conversation, COVID and the classroom, with our alumni and the professionals, TV Asia, American University of Antigua. I'm now going to ask general advice for students who are looking to go into your field or looking to go into medicine for that matter. What would your advice be, given the state of affairs now with the pandemic and everything that's going on in the medical fraternity? What would your advice be? Can we start with Dr. Soni?
Sure. So my advice for the new generation or for the incoming students who want to go into medicine is we welcome you with open arms. In the United States, in the next couple of years, if not already, we have a shortage of healthcare workers. This pandemic has shown us that there's a lot of humanity in us. There's compassion, there's resilience. The one word that we often attribute to children, that children are resilient. Through this pandemic, we have noticed when there was a surge in different states in the United States, we've had physicians and nurses come out of retirement, say that, they're willing to fly any place in this country to help out in the areas where you see that surge. For the individuals that we mentor here at Caramount, we see a passion. You usually, for example, if there's a fire, right, you see people running out of the building. You see those firefighters running into the building. And I think any healthcare professional who's doing it for the right reason, we're all the same breed, right? This attaches us. We're the ones who are willing to, stay on, move forward. We are the ones who are mentoring our young individuals. And I see that passion. I don't see people saying, no, medicine, I don't want to go into the field. I don't want to put myself at risk. I see more individuals saying, how do I start? Where can I start? Where do I start to look into medical schools? Where can I start to make sure that I am starting my initiative and becoming a medical professional because they want to help? And the humanity, the compassion, and the resilience, all things we attribute with a pediatrician and with our kids, is what we're seeing. There really is a passion of wanting to become a health worker, even during a global pandemic. And I find that remarkable. And it speaks a lot of our humanity.
Dr. Danya, what would you say?
Yes, so the satisfaction that one gets when a child who's miserable with the disease walks out of the healthcare setting with a big smile on the face, that satisfaction is unparalleled. And what I would tell is the COVID pandemic has taught us that infectious diseases, it's such a dynamic field. New infections emerge, old infections like chikungunya, dengue, etc. re-emerge. So it's pretty exciting, it's pretty challenging. And while you're dealing with these infections, you're also trained about infection control, about antimicrobial stewardship. So you are also involved in policy making for your institution, for your state, for your country at global level. So that is also another part. Plus, you can do research. You can have a breakthrough research which can actually help cure COVID. So, I mean, there are multi-pronged aspects about being in this profession besides what my co-panelists said. So it's a very fulfilling branch, and it's a very promising branch. So if you have the passion to heal, please pursue this field.
Wonderful. I think that's very sound advice for all the prospective students and parents watching this panel, because everybody is looking for hints, everybody is looking for tips on are we making the right decision by going into medicine? It's a long field. What are we doing? It's very difficult, but yeah, no, I think that's right. Now, Dr. George, what do you think the one thing students should ask themselves before they apply to medical school?
The one thing they should ask themselves is if they have a passion for this. In the previous question, we there were certain words that emerged that I think were very moving to me. Dr. Soni mentioned resilience, and Dr. Danya mentioned having a passion for what you do, and I think those things are equally important. That in whether it's medicine or another field, that whatever you choose to do, that you have a passion for doing it. And with regard to medicine, and speaking for my co-panelists, I wouldn't trade it for anything. We had discussed an earlier topic about maybe some of the financial impact of choosing
Yes.
a field in medicine, in particular a field in pediatrics. But I'll be honest with you, I wouldn't trade it for anything. This is the most rewarding thing I've done in my life. There's a lot of happy days where you celebrate different achievements and milestones with your patients and families, and there are sad days, and there are days that you're moved to tears and have varying emotions just because of setbacks and tragedies that your patients and families experience. And so just going through that dynamic process of being able to humble yourself and help someone who's in need, to get them through an adversity that they're facing is rewarding, and I wouldn't trade it for anything.
Now, Dr. Danya, let me ask you a question. I know, with all this COVID, the NEET exams are getting postponed. We're getting calls every day from students from India and other countries who participate in equivalent exams as to what do we do? Can we come to you? Can we come to, American University of Antigua? Or can we go to a US medical school, which they don't realize is just as difficult? But what would your advice be to the cohort from India who's watching this program and really want to do medicine, but because of pandemic have been put back by, it's going to be 2 years now? What would you advise?
I would advise to keep all options open to try. Basically, even if you learn from a medicine from a particular region, medicine is a field which you learn throughout your life, throughout your career. So one may not be very demanding about which institution or which place one has to study, because it's a lifelong learning process. So if whenever you get an opportunity, you grab the opportunity. You keep trying, whether it is NEET, whether it's a foreign exam. Also, of course, a lot of other factors also influence the decision, like say finances will definitely impact the decision. But I would urge them all to try different exams and just take in what they feel is suitable for their career.
Would you have any words of advice to the students watching this now?
What I was going to say is, when you interview somebody, initially you ask, okay, which medical school are you from? Where did you get trained? But once you get beyond that, it becomes you. It's you as a human, as a physician, as a compassionate physician. So once you've been in the field, this surgeon is excellent orthopedic surgeon. And they might be from Antigua, they might be from Guadalajara, they don't really care whether you graduated from Harvard or somewhere else. It becomes you and the patient at that point. So if you're a passionate and compassionate person, go for it, whether it's Antigua or it's U.S. Medical College. Once you become a physician, you are parallel to everybody else. You're in the same level field. So you have to show your worth, and you have to show that you are the compassionate person that the family is looking for.
I totally agree with you. And I think my alumni here as well are standing proof that, whichever school you graduated from, you're an international medical graduate, but you can be very, very successful. Dr. George, you were going to say something.
To say one thing that Dr. Sehgal just said that I think people should take into account is that there's a lot of collegiality, especially after you finish your training. And Dr. Soni and Dr. Chaco, you can answer this as well. But for me personally, I haven't encountered a situation where someone asked, where I went to medical school or did residency or fellowship, because once you reach this point, they call you doctor, and you have that trust with your not only with your peers but also with your patients as well. And the piece of advice I'd give to families that are considering this is that they have to focus on the big picture. Now, there's a lot of hard work that goes in between, the process now and reaching the point where we're all at. But that hard work is rewarding, and if you have a passion for it, then by all means go ahead and pursue it. And as Dr. Soni said, there's a need. We need people and we need help. And if this COVID-19 pandemic has taught us anything, it's really emphasized that.
I actually am at the very end of my journey. I started this journey with Antigua in 2011, and now it's 2021, and I'm finally at the position where I got a job and I'll be working as a general pediatrician, which was my goal from the very beginning. And I guess for students who are at the very beginning of that journey, I just want to tell them that it is possible. It takes a lot of dedication, a lot of hard work, but at the end, it is worth it. And I'm hopeful that for the rest of my life, I can be a good service to my patients and their families. And that's ultimately the goal for any physician.
Very well put. And yes, and needless to say, the American University of Antigua is really proud of our alumni and their achievements. As most of you know, I keep picking up the phone and asking you to give me a blurb for social media. So yes, no, it is a long journey. It is a very worthwhile journey, but it's a commitment, as Dr. Sehgal said. It's a commitment and a passion, as Dr. Dhanya said, that you need to find in yourself before you start this journey. We're coming to the end of our really exciting discussion, and I think you all as doctors have given us so much of information. I know the parents watching are going to be thrilled to hear from you. And yes, vaccination. And one of my friends was saying she's going to tattoo it on her forehead, "Are you vaccinated?" Because she's so tired of asking people. She said, "I'm just going to tattoo it." So yes, that is the answer to this. I want to thank all of you. Dr. Dhanya, you've stayed up late for us on a working day. I really appreciate that. Dr. Sehgal, you took time out from your clinic. Dr. George, I know how busy you are and your work never ends, but I really appreciate having you on. And Jessica, my neighbor, my sweetie, it is so nice to see you, so nice to hear from you again. So glad you're being so successful. This is what makes all of us at the American University of Antigua proud and satisfied. This is our commitment and satisfaction. We are not doctors, but we are so satisfied when we see all of you and that you've been successful. So we are doing something right. Somewhere we are doing something right. Thank you again to our panelists who have taken time out from their busy schedule to be with us. Dr. Sehgal, thank you for sparing time from your patients. Dr. Dhanya, thank you so much for staying awake so late and participating with us. Dr. George, I know I've taken you away from your students and your patients. I appreciate your coming on this roundtable. And Dr. Chaco, I know you are very excited to start your job, but thank you for sharing your experiences. And Jessica, my alumni neighbor, thank you so much for taking time out from your clinic hours and joining us on this panel. For all those who have tuned in with us today, I appreciate your giving us the time, and I hope you have been able to gather some information which is crucial to you. Please be sure to follow TV Asia on their social channels to see which topic we are going to be speaking about next. If you have any questions, please do send it in to the network. Thank you.